Yes, indeed. The Chew with Dr. Drew. I'm very honored to have Dr. Drew Martin, Markham. Sorry, Dr. Drew. Your practice has moved over to the North Kinton Mall, which is right behind the Dairy Queen. And I'm looking at the juxtaposition of the Dairy Queen and all the things we were not supposed to eat as kids, and the fact that your practice is right there. Was that a bit of a strategic move?
It's more coincidence than anything. We've often wondered whether we might be able to do a little footbridge across the wetland over there to make things easier, but there's enough of a barrier there.
Now, you've been practicing for 17 years, and there's been a lot of advancement in the field of dentistry, and many of the techniques that you may engage, most of us lay people have no idea of really what it is that you do.
Sure, and we may get into more detail on some of those over the next 6 weeks, but part of the reason I ended up in Huntsville in the first place was because I wanted to have my own practice in order to do some of the things that I was learning about. A lot of dentists, when they get out of dental school, bounce around from practice to practice as associates for a few years, and when you're in those practices, you take on the role of the owner and sort of do the things that they do. But at the same time, you sort of learn some of the things that you enjoy more than others. And that led me into some advanced training over the last 12 years, really, that deals with chronic pain, jaw issues. We do some cosmetic stuff. We do some sleep dentistry. That all
And what is
relate.
that? Exactly what is that?
Well, sleep dentistry is if someone has sleep apnea, there's a lot of things that we can do in an exam to screen for those issues. We can't make the diagnosis, but we can refer someone to a sleep physician in order to get a proper diagnosis. There's a lot of side effects from a cardiovascular standpoint that can happen that really can shorten lives. Now, CPAP is the machine that most people end up using, but there can be oral appliances made as well for those people that don't tolerate the CPAP.
Now, over the years, I'm one of those folks, and we're going to deal with this in the course of the Chew over the summer. I'm one of those folks that hesitates to go, and because of past experiences, I remember having a root canal done. And then it just continued to be, I don't know whether it was a bad job that was done or it was maybe something, hereditary in my family, but it just continued to give me a problem. And things of that nature, kind of kept me away. But as I said to you earlier, techniques have changed, haven't they?
Certainly. And, I'm not going to lie and tell you that every procedure that we do is simple and fun, because that's just not true. A lot of medical surgeons have the benefit of the patient being asleep while they're doing the work,
right.
And therefore
of course.
Compliance is much easier. And so we're generally dealing with someone who's getting needles in places that are uncomfortable while they're awake. And if you have a negative history on top of that, it makes it very, very difficult for a lot of people to even set foot in the office in the first place.
Well, I had an opportunity to go into your office last week. I must say I found it very soothing. Your staff were very accommodating. And, I'm noticing things that I'd never noticed before in a dentist's office. There's beautiful music. There's beautiful soothing waterfalls. There's TVs. A lot of people, find it very soothing to be able to look at a screen to distract themselves,
Absolutely.
I guess.
Yeah, distraction is a key thing. I think communication is also a key thing, because there's a fear of the unknown many times when people are coming in for a procedure that they haven't had before. And while we try to, discuss it ahead of time, there's still always going to be that fear. But there's not a better feeling than when we get through a procedure and someone looks up and says, "Oh, that's it." And that really helps build confidence for the future in terms of their oral health, because there's a lot of people who have essentially been ruined by their childhood experiences at the dental office.
Mm-hmm. Now, before we run out of time, and I could have you here for hours and hours just talking about things. Sure. Your background, you studied at U of T, and then you did your dentistry where?
I did a physiology degree at the University of Toronto, and then I did my dental degree at the University of Michigan.
You, as I said earlier, you've been practicing for 17 years. What are we going to be looking at over the next 6 weeks?
Well, there are a few themes that I'm hoping to address. And some of these are things that everyone maybe is aware of, but doesn't really get a chance to discuss or maybe even feel comfortable asking their dentist. So I'm thinking next week we'll talk a little bit more about fear and anxiety. I think we'll talk about the financial side because dentistry is expensive. There are some reasons for that. There are things that can help with that, but in terms of dealing with insurance can be frustrating for everyone. So those are some of the things that I'd like to get into.
That's great. I'm looking forward to it. It's an honor to have you here. Your reputation precedes you, Dr. Drew Markham. I can't believe I messed up your name on the very first show. We're going to be doing this each and every week. The Chew with Dr. Drew. Dr. Drew Markham, a beautiful office and a wonderful staff at the North Kenton Mall in the call that Commerce Park. Is that what
it's
they call
down in
it?
that area of town.
Yeah.
Yes.
It's right behind the Dairy Queen, and it makes me smile every time I think of that location. Dr. Drew, I'm looking forward to more discussions about a very sensitive topic for a lot of folks.
Yes, and one of the other things that we're hoping to get is some questions from the people that are listening. To maybe ask those questions that you're afraid to or haven't thought about at the time. And I've come up with a couple that I often get at the office to maybe stimulate some thought.
Great. I look forward to that. And it'll hopefully educate me as well, because I'm a child of a different generation where it was a scary proposition. But like I said, I mean, I know that you've been trained in new techniques to help make it as soothing as possible. I'm at a loss for words.
There are times where we joke around with what our goal is when someone comes in who's very nervous, and sometimes our goal is to make it not half bad. But at the same time, because my team is so great, we have a lot of patients that say, "I never would have thought I would enjoy coming to the dentist, but I really do," and that feels really good.
Wow. Well, thank you, Dr. Drew. Dr. Drew, the Chew with Dr. Drew. We will be back next week, Monday at 9:45.